My name is Angela Branch. I'm an assistant professor of medicine at the University of Rochester and an infectious disease specialist. And I also am co-director of the University of Rochester Vaccine and Treatment Evaluation Unit, which is a large NIH grant that allows us to study new vaccines and treatments for emerging infections like COVID. Yeah, so I think the first thing people should understand is that we were dealing with a global pandemic. When we started developing these vaccines, we had no idea that millions of people were going to die within just 1 year's time. We really haven't seen anything like this in the history of modern medicine. And so, as everything unfolded, the urgency to have a way of preventing people from becoming infected and risk dying became just really, really high priority. It was hard to kind of figure out, what do you do first? Do you work on treatments? Do you try to figure out how to prevent infection with things like masks and so forth? Or do you start working on a vaccine because you're never going to be able to control it any other way? And I think we were learning about disease, so we started with the first two things, and then quickly realized how devastating this was going to be, and that we actually needed to also be working on the prevention of it, and that was really the only way we were going to end the pandemic. Now we're a year into it now, and we have three vaccines that have been licensed here in the United States, four in the world, counting the AstraZeneca vaccine, and all of them are amazing vaccines, which have now been shown to be extremely effective at preventing people from contracting COVID, and especially effective at preventing people from dying from COVID, which is what we wanted to do. So when we started this process, what it involved was taking decades of science in developing vaccines, and vaccines specifically for coronaviruses, not just like vaccines against the flu or other things, but what we knew about developing a coronavirus vaccine and then rapidly adapting it to be specific for the COVID-19 pandemic. So that's the first thing I think everyone needs to understand, is that it actually didn't take a year to develop these vaccines. It took decades. It's just borrowing what we already knew and really adapting it. So there are three ways that vaccines are being made. The first is the Pfizer and Moderna vaccines. And those actually ended up being the easiest to test or to put into clinical trials, because developing them was really quite simple. It utilizes something called messenger RNA, which is not genes, it's genetic instructions. It's sort of like if you were building a house, how do you explain to the contractor what the blueprint says? And it usually involves lots and lots of conversations between the architect and the contractor, and the potential homeowner even gets involved. And that conversation is exactly what messenger RNA is. It's instructions. It tells your body, how do I do something that allows you to develop a defense against COVID? And so what the instructions we're giving to the body with these vaccines, with the mRNA vaccine specifically, is to build a protein that is necessary for the virus that causes COVID to actually cause infection. And so once we've given those instructions, the body starts churning out protein, and even though the protein itself can't harm you, it does allow you to develop this training exercise that prepares you to defend yourself if you actually become exposed to COVID. And so the messenger RNA vaccines are just that. It's genetic instructions packaged with sort of an oily bubble layer, called a nanoparticle lipid layer. And then we add to that some sugars and some minerals which preserve the vaccine. There's really nothing else in it other than that. And once we inject you with that, everything that the vaccine is made of actually rapidly degrades, sometimes within hours. And so you don't even have remnants of that vaccine left in your body after a day or so. And what it's left, though, is this triggered training exercise that allows you to have a defense, an immune response, which becomes memory. And that memory is what's going to defend you if you ever need to, if you're ever exposed to COVID. And then other vaccines are made a little bit differently. So the mRNA vaccines are sort of the newest way vaccines are made. But the other kinds of vaccines, Johnson and Johnson, the AstraZeneca vaccines, that's actually a more traditional approach. It leverages how we make Ebola vaccines, for example, and it's just substituting a sort of a delivery system, substituting within a delivery system something specific for that protein we talked about. And then there's two other vaccines that'll come down the pike, which are very similar to flu vaccines. So it's, again, very traditional vaccine technology. And all it is giving you purified protein, which again triggers your body to start to defend itself. I think people need to understand that vaccines aren't meant to defend you. The vaccine is really just the thing that triggers your body's immune system. And whatever that vaccine is composed of, it actually gets degraded and sort of disposed of by your body's garbage disposal within days. And so I think that gets lost a lot in the messaging around vaccines and around why we know they're safe and why we're not really concerned that Big Brother's watching you or those sorts of weird sort of things. Yeah. Yeah, I really think it's fear of the unknown that's driving this because, by and large, in Western New York, we have pretty high vaccination rates when it comes to things like influenza and hepatitis and tetanus and pneumonia, all sorts of things that people get vaccinated against every year. And nobody ever thinks to question, well, what's this vaccine made of, or how does it work? Some people do, but it's kind of a rare thing to see in practice. Most people have a lot of experience with vaccines and do trust them. So I think with COVID, it's sort of the fear of the unknown, not knowing, and when something new is being introduced, it always kind of makes you pause and think, well, how exactly did they do this, and what exactly is in these vaccines, and how do they know it's safe, and how could they possibly have done that in a year's time, and is the government involved in this in some way, and just all of these sort of questions that the newness of it all and the unknown of it all kind of makes you think. And I don't necessarily think that's a bad thing. I think that's rational behavior. If somebody was telling me, oh, I have a brand new drug or a brand new medication or a brand new car or a brand new place to live, or anything that's brand new, I'd stop and think, well, is this good for me or not? And so I think having sort of that moment where you pause and you kind of listen to what's going on and you weigh the risks and benefits is a rational approach to thinking about COVID vaccines. And then once you've done the research and you learned what you needed to learn, and you really kind of understand this, what the scientists and doctors are saying, what we know about the safety of it, and then you weigh the risks and the benefits of getting a vaccine like this. And I think that'll help a lot of people to really think about that. Yeah, I'm worried about us getting there myself. I think that we're doing really good right now, and we're in the period of time where there's not enough vaccine available for all the people that want it. So we haven't really hit that wall of now we're at 50 or 60%, and we're dealing with now a lot of hesitancy, and how do we move from 60 to 80? And I think we're going to start to see that emerge more and more in the next couple of months. And the difference between like 50% or 60% and 80% is going to mean how much longer the pandemic continues. If we get to 80% this summer, there's a really good chance that we can end the pandemic by the end of the year. If we don't, new variants are going to emerge. Disease is going to continue to spread. People are going to continue to be sick. We have another tough winter ahead of us, and maybe even another tough year in 2022. And so how long this pandemic continues, how long it continues to affect our ability to recover our lives, our communities, our nation, I think is really going to be decided by whether or not we can get to that 80% quickly or not. So it's an important goal. So I think as people are making decisions about vaccines, they have to consider that this is not just about you per se and your family. It is about you and your family, because we want you and your family to be safe and protected, and not to have to suffer the risk of becoming severely ill and maybe even dying from COVID. But we're also thinking about what's best for our community, what's best for our country. and when our schools can open, when our kids can go back to school safely, when we're going to be able to have ball games again, when we're going to be able to go to the beach in Miami without having the governor shut it down, when we're going to be able to just kind of recover our economy and all the things I think that make for good quality of life. All these things are going to be held up by the ability to really move past the pandemic. And I think nobody wants to get there quicker than me. And so I know most people feel that way too. So, as I said, I think hesitancy or even sort of pausing to really try to find out details about the vaccine is a rational approach. And I think I respect people who do that. I think, though, that one of the things people have to just keep in mind, though, is that we're about a year into vaccinating people with these vaccines. The Pfizer and Moderna vaccines went into arms all the way back in February and March. And so we do have a lot of safety data. We do have 8, 10, 12 months of following people who've been vaccinated. And now with the Pfizer and Moderna and the AstraZeneca and even the Johnson & Johnson vaccines, literally tens of millions of people around the world have now gotten these vaccines. And so if you're concerned with safety, like how do you know it's safe? How can you assure me that it's not going to cause something severe to happen? I think the data is there now. Now it's possible that there could be something that happens 1 year after you get the vaccine. But the other thing to keep in mind is we know that the majority of side effects related to vaccines happen within the first couple of months after you've been vaccinated. And so if it's not happening, then it's extremely rare and extremely unlikely to happen at all. And so the idea that you need to sort of sit and wait for a year or two to really understand the safety of these vaccines is just not true from what we know historically. And so I think one of the things, there are lots of questions that we have yet to answer with these vaccines. Do they work in kids? How well do they protect pregnant women or people with cancer? Will they last for a year or just 3 months or 6 months? What will happen with the variants? There are lots of outstanding questions that as scientists and physicians we're working really hard to answer. But the question of safety, I think, is one that we feel really comfortable that we've answered. And so I hope that people will keep that in mind as they're making decisions for themselves and their families.